अस्सलाम वालेकुम सर।
वालेकुम अस्सलाम मनस।
वेलकम हो तीनों हज़रात। आज मेरे साथ एक खुसूसी मेहमान, वन ऑफ माई बेस्ट टीचर, वन ऑफ माई बेस्ट मेंटर, बहुत गाइड किया है and he will be still guiding me in future as well. Welcome sir to our podcast.
Thank you so much for having me, Anas.
How did you first become interested in medicine as a career?
So growing up, I was inspired mainly by my father. You know him, of course.
Yes,
Dr. Mubeen, he works
absolutely.
here. From childhood, I think everyone is inspired by their father to a degree, and it was just seeing how much respect he had gathered from everyone, and generally his personality. He was always somebody that I looked up to. After that, then obviously we've all gone through the education system. We go into O levels or metric. We have to decide there: do we go medicine? Do we go business? I will say that I wouldn't say that I had a burning desire that yes, the medicine is all I'm going to do. What I'll say is I kind of just drifted into medicine, but it felt comfortable for me the entire time.
Okay.
Once I was in medicine, then it was a rocky road after that, but I'm happy with my decision at the end of the day. One thing is, although I complain a lot about medicine, it has its flaws, but I am very happy that I am in medicine. I'm happy that I'm a doctor.
Can you tell us about your medical school experience?
Yes, so many of you know I'm a graduate of the Khan University. I'm the class of 2020. I loved my medical college experience, Anas, and for a lot of different reasons. I think, especially in Pakistan, a big problem is we aren't able to grow up throughout, for example, we call it college and A levels or FSE. It's not college. You're not growing up in college, I'm sorry. Medical college is that first actual experience of the real world. It's very sheltered, but it's still an experience.
Exactly.
And I think I changed a lot in medical college. I started seeing things differently. I grew up a lot more, although I still feel like a child, but I definitely grew up a lot in medical college. Aside from that, I did enjoy the friends that I made in medical college. Quite frankly, the friends you make in medical college, they have seen you at your lowest, they have seen you at your highest, they have supported you to your highest. So those are some of the best friends I've ever had. I've been in contact with them. I've been in contact with other friends as well. And overall, the environment in Agha Khan, the start was rough because it felt like a fresh start, and I would think I was surrounded by some of the smartest people I've ever met. I felt like an idiot there. I was like, what am I doing here? I don't belong here. I felt this flat out. But then slowly as I gained my footing and I was learning more about medicine, and like I said, I just drifted into medicine. I started learning more about what was enjoyable about medicine. It was where I could, for the first time in my life, I felt passion. I felt like this is something, that I do really want to do. And then of course, aside from that, I lived in a hostel. All you people living in hostels, you know how fun hostel life is. So yeah, medical college, I think, alhamdulillah, I was blessed with a very great medical college life.
Okay, that's wonderful, sir. Sir, can you tell us about a particularly memorable case or patient you have treated?
Yes, so I often get asked this. So there's a few patients that I feel like really defined the kind of doctor that I wanted to become. So first one, I remember in third year medical college, I was doing an ophthalmology clinic. Then a patient came in and they were Pathan. So although my Pashto isn't perfect, but it was enough for them to see me as a brother. 20 minutes
Okay.
So I remember they had come with a bizarre complaint. I was a third year student. But after the conversation, everything, they seemed happy. I can still remember the doctor sat down, examined the eye, and just said, "Inki nazar wapas nahi aa sakti." And the shift in that patient's expression, the sadness when it dawned on them, and at that moment I felt heartbreak, and I was like, I want to be able to be a doctor to develop everything that we never have to say that to a patient. It's very idealistic, mind you, but it's just something that I couldn't take. And another experience that really shaped who I want to be as a doctor, this was again the same language. Speaking Pashto in Agha Khan was such a huge benefit to me. So there was another patient, they were from Afghanistan. Thankfully then, although they were speaking Farsi, they would at least understand what I was saying. So I remember seeing this patient admitted in the ward as well, and like he wasn't doing too well. He had a neurosurgery procedure, and the patient was just not oriented or anything after that. His father was with him. Basically they told us then that we cannot afford further treatment here. We need to go back to Afghanistan. Like he said, I don't have any money with me. There was a huge hassle. It took me, I think, 30 minutes. The consultant had even left me alone, and then I'd come and ask them intermittently. We were trying to make arrangements for follow-up with doctors. We even then eventually connected them to doctors in Peshawar.
Okay.
At the end of that, Anas, the patient, he asked me one simple question, and again, that broke my heart. He was like, da la wele che de maris zama maris mzueta chalso de kadisidi wata. And just the fact that this man has spent all his resources, he has to go back to his country and he doesn't even know what's happened. So that was the second thing that I was like, no, I want to make sure my patients know what's going on. These are again obviously very extreme examples, but they are definitely characteristics that have stayed with me throughout, and I think often about it.
What advice would you give to someone considering a career in medicine?
So times have changed. I think in Pakistan, this is a kind of default thing that medical talarsha.
Exactly.
Doctor talarsha, der zyada khabai. I will say one thing, I think times are changing. Medicine is not as a sure shot of a great life. It's just not that anymore, unfortunately. So my advice would be, if you have a passion for something else, definitely consider that. Because medical is getting hard, it's getting exhausting, it's getting financially burdening as well. You need to think about all of these things in the long run. There are some of us, we don't have to worry about this. Like alhamdulillah, there are some people that are blessed like that. But for the people that do, definitely think about other careers. Again, I'm not saying that you don't drift into medical college. I drifted into medical college. Alhamdulillah, I'm happy that I did. But definitely think about other things. I would say this for medicine. And if you're coming into medicine, you're going to love it, but it's going to be hard. That is the one thing I would definitely say to you guys.
Exactly. Yeah. Love it, sir. How do you balance your personal and professional life as a doctor?
Oh, hard question, very hard question. So again, for people who don't know, I was recently married and I did not know how much that would change my life.
Congratulations, sir.
Thank you so much. It changes life a lot, and it changes a lot. You need to learn to prioritize for sure. And I think that comes into one of the things that's super hard about medicine, because you can't care about yourself as much. You need to be looking out for your patients. At the same time then, as a human being, you need to look out for your family. Figuring out how to balance that is very difficult. Alhamdulillah, right now, I have time. Yes, there are going to be times in the future where it's going to be harder and harder. I'm going to work late, I'm not going to be able to come home. I think one of the most helpful things is having understanding family. If they understand what's going on, if they help you out, you help each other out along the way. And this works both ways. You also can't just come home late and then just directly go to sleep. You'll be tired, but you need to also put in effort to reciprocate that effort. So I think it needs to be a two-way street for sure.
Okay. Yeah. So what do you enjoy most about your job as a doctor?
So this is, there's definitely two things I think that I would enjoy. So I've always enjoyed puzzles, and I think there's a certain satisfaction in, figuring out a tricky scenario. It doesn't even have to be, house MD level, super complicated. No, it can be very simple problems, but there's a satisfaction in solving that problem. At the same time, that problem solving is helping another human being. And I'm idealistic like this. I refuse to believe there is somebody out there that does not get happy when they help someone else. It's genuinely one of the most fulfilling experiences there is. So in this job, it's amazing that you're doing this job, you're solving puzzles, and you're helping other people out. I think that's a wonderful mix of these things, and I don't think any other career has that kind of a balance.
Exactly. So what do you consider to be the biggest public health issue facing our society today?
Greed. This is breaking the medical system. Healthcare is a right. Nobody deserves to be in pain. Nobody deserves to be sick. And again, I'm not just talking about Pakistan. I'm not talking about those people that are just charging extra fees. No, I'm not talking about that. I think people need to understand on this, the level this is happening at. I'm going to be going to the US. It's a fact that there are, for example, pharmaceutical companies, there are big companies that are interfering with all of this. And they are causing problems. To what benefit? Simply all about money. It's just about money. And when you're on the other side, when you're treating the patient, or if you are the patient and you're suffering because of that, it's absolutely awful. When you look at the doctors, we want to treat people. We don't want to be charging people that much. There are exceptions, I won't deny that. But we are not able to just because of limited resources. And why there's limitations in resources? It's simply because there's some greedy people out there.
Exactly.
They're keeping it all to themselves, unfortunately.
Like nowadays we prioritize money.
Exactly.
As compared to patient. Like we should prioritize patient.
Exactly. For people like this, I believe that every policy that's made, every person that's working towards, in the medical field specifically, the priority is treating a patient.
Treating a patient.
Yes, money is important. I'm not saying that. We obviously want to all be comfortable. But there should be a balance.
Balance, yeah.
If you're prioritizing the money way more than your patient, there is a problem there, and please stop doing that. That's just where my view is, at least.
I like it, sir, and you'll nail it.
Thank
I
you.
love it. What do you believe are the most important qualities for success in medicine?
So, as I said, medicine's hard. Medicine is very hard. There's a term that goes around a lot nowadays, resilience. Being able to go through those hard times and not letting it get you down. That is probably at number one. There's going to be very hard days in medicine. There's going to be very hard days in your life whenever you're here. You have to be able to get through those days. And there are good days to balance it out. You just have to believe that those good days will come eventually. Aside from that, there has to be a level of selflessness. Again, I even said this, you are going to be prioritizing your patient. You have to think about yourself as well. You have to think about the benefit of the patient. And that does become a bit of an important factor in all of it, that you can't just be somebody who just cares exactly about your own wants. Aside from that, you have to be friendly. This might be a bit of a controversial one.
Yes.
But I do think it helps a lot. It helps the environment, the team you're working with, the patients, the seniors. It helps a lot if you're somebody who's friendly.
Who's friendly?
Friendly doesn't mean extroverted. It means somebody approachable, somebody willing to talk to somebody.
Yeah. Exactly. So how do you stay motivated and driven in your career as a doctor?
That continuous pursuit of being better, that is something that definitely keeps me motivated, and it helps to surround yourself with motivated individuals as well. I can say that my friends are also the people who are looking up. They're trying to get to the next step.
Okay, so now we talked a lot about your personal and professional life. Now come to the very hard topic, and I'm really excited for this, the USMLE.
Yes.
So the first question, what is the cost of USMLE exam?
Yeah, so any of you who've come to me asking for USMLE advice, probably the first thing I tell you, grande. It's very expensive. And not even hard, it's expensive. It's very expensive. Now, objectively, if we look at it as, okay, just the USMLE exam itself, step one, about $1,100. Step two, $1,100. For conversion, I'll tell you this, that like my current salary equates to about $200 per month here in Peshawar. So when you put it into that perspective, it's a lot of money.
It's a lot of money, exactly.
But additional to this, when you're approaching the USMLE pathway, there are so many other costs. So many other costs that come in. Just for step one, you're going to need to spend money on learning resources. Step two, you're going to need to spend money on learning resources. When you're applying for the USMLE pathway, you need to look into other things. You need to go for observerships. You have to pay for a flight to America. You have to pay for observerships. When you're going through ECFMG, just registering for the step one, you have to pay about, I think it's a fee of $100. $160 now, which again, I told you my month's salary is $200. That's my month's salary gone. It's a very expensive process. And the cost does keep adding up. Now that I have matched into the US, when I think about the cost, I think a student asked me the other day, can be estimated to be $25,000 to $30,000. I was like, yes, and I will not be surprised if it was actually more than that. So keep that in. I would say this to anyone who thinks about the USMLE. The first thing to do is think a little bit about finances. Again, alhamdulillah, some people are blessed. They don't have to worry about it. Great.
Awesome.
Some people do. They need to just think about it. There it's possible. They just need to think about ways to go about it then.
Awesome.
So the cost is pretty high up there.
If someone wants to choose a USMLE pathway, they should keep in mind that we should think about cost.
So it's definitely, especially for the students watching, it's a conversation you need to have with your parents. You need to, because again, they're the main ones supporting you. I've heard there are exceptions, but if whoever's supporting you, you need to talk to them. You need to say, hey, this is a pathway I'm considering. It's going to cost a lot of money. Would it be feasible for me to go through with this process? And again, if the answer is no, which is a very realistic possibility, there's nothing wrong with that. But for the people that can, yeah, by all means, go ahead. Just keep it in mind that, yeah, you're going to be spending a lot of money before you're making that money back. It's going to take a while to make that back as well.
So should we consider it is tougher than other tests or other exams? Should we consider that in mind?
I will definitely say, so I don't like saying that just because it comes across as arrogant that, oh, matul magran exam worko. The facts that were in front of me. So I gave my PLAB 1 recently. I studied not as much as I should have. Admittedly, I should have studied more. But I had given my USMLE step 1. I had given my USMLE step 2 by that point. I definitely had a very easy time passing it. Like with the amount of prep I did, I don't think I should have passed, but I very comfortably passed. I will say then on the other side, for example, FCPS. There were definitely questions. I had to study for FCPS. I passed FCPS, but I studied for it because it was a different style. Which one of now then the difference would be I studied for FCPS for 2 months. I studied for USMLE for what, 2 years, and then step 2 for 2 years. Does that equate to it being a more difficult exam? I will let you all be the judge of that. I don't want to say it, but I do think it is. It's definitely a tougher exam. It is definitely, like, nobody can deny that.
So what are the best resources to prepare for USMLE exam?
Yes, the all famous question.
All famous question, yes.
So again, I tell people this, that we are very blessed. Our generation, we have the internet, we have we have so many resources. Literally just we type in and then we'll get a lot of resources. This is again the biggest blessing, but it can also be a pitfall because what we do is we use too many resources.
Too many resources.
The first thing that I want to say about before even telling about the resources I used, stick to your resources. Whatever works for you, however you study, is not how I study. Maybe there's a big difference between those two things.
I agree with that.
Yeah, so as far as I think for step 1, what I personally did, there was the Boards and Beyond videos. I think they were excellent. They covered it all perfectly. After that, I went into a question bank. The one thing I will say, a question bank of any sorts is essential. I feel like this is generally a trend coming into medicine. If you think about it, your MBBS exams, you guys get practice questions for that. FCPS, you get practice questions for that. PLAB has made their own question bank, Plabable. So this is a thing that we need question banks, and for the USMLE, I think it is 100% essential. The gold standard is UWorld. Again, I tried and tested it. Yes, it is what worked for me. It's not necessary that that's what works for you. Just keep that in mind. But I would say that for step 1, those were the 2 main sources I used. For step 2, I just used UWorld, and I was studying almost every day. I think 10 plus hours a day. What the best resources are, and then again, another thing I forgot to mention, my flashcards. You know that I love my flashcards. Any student that meets me, you know that I immediately say, download Anki. It's a very good thing. I love the flashcards, mainly because the convenience. I could study on the go, and it would repeat, it would enforce things. Because I know we don't do pure ratta, but there is still ratta involved. You need to memorize some things. Flashcards help a lot with that. The last thing that I would want to say about resources, during your MBBS, this syllabus for step 1, this syllabus for step 2, it's medicine. You are also studying medicine here. If you, people that will, bring up long books or short books to him, if you have studied your long books and properly during medical college, you will definitely have an easier time in step 1. There were some topics in medical college that I knew very well. I had a much easier time in step 1, pharmacology being the main one. I knew pharmacology very well in medical college. Then the subjects I didn't know, anatomy, biochem, both maar khaiye maine usme. It was very hard to try and memorize all of it. So while you're studying for your MBBS, don't think that, oh, I should use the step 1 resources abhi se. No. Study your syllabus. That syllabus is the same one that will come up there. Save those step 1 resources for the end, just so that you can revise for the exam.
Which one question bank do you recommend?
So again, UWorld is the gold standard. My problem with it is the cost, and everyone should have a problem with it. It costs a lot of money. It does. Personally, if you ask me what I had used, for step 1, I actually 100%, no, I didn't 100%, I did 80% of Amboss. And even that reason was my institution applied and we got a discount, so I had the Amboss discount. For that reason, I did 80% of Amboss. You might be surprised to know, for step 1, I actually only did 30% of my UWorld. When people saw my graph, they thought that I'm doing it the second time. No, that was my first time doing it. But the reason I would go in support of UWorld is that interface is exactly the same one that comes up in the exam, which will definitely make your life easier.
So what are some common mistakes to avoid while preparing for USMLE?
I think one of the biggest ones that I have a big problem with, announcing to the world that I am studying for USMLE, but not actually studying for USMLE. So many people. So a lot of students do come up and they say USMLE, but then some of them will just say, Sir, I'm soch ko USMLE work ko.
I totally agree with that, sir.
Soch ke start studying, please. I would heavily advise it. I think number 1, that is the biggest one. The reason that I think it even becomes dangerous, Anas, is because people will discourage you right off the bat. तो चाहते हुए अगर USMLE दही खुद ना PC थी, match न मिलाएगी, these, and again, these are realities. But when you haven't even started studying and someone tells you this, it's going to hurt. It's not going to help your chances. The second one, I think people are going overkill on the amount of resources. Again, it's good to use multiple resources, but I think it's a bit pointless to, do all of AMBOSS, then do all of RX, then do all of UWorld, then do all of God knows what other question banks there are.
Yes.
It's a bit pointless at that point. So
Like overload yourself with
Yeah.
too much information.
Yeah, don't overload yourself with that much information. Just stay a bit focused on whatever works for you. And I think one of the biggest things, Anas, trusting yourself.
Exactly.
You know how you learn better. Some other person, you need to read all these PDFs and then you will learn. Maybe he learns better by reading. Maybe you learn better from videos. You can just watch the videos. They say, oh, you don't make notes while you don't make your own flashcards. Maybe that doesn't work for you. Understand, as long as you know how you study, once you realize that, stick to it. And again, one other thing, buying UWorld too prematurely. UWorld, for us, we have to use it in a very dedicated time period. We have to say, okay, no, we will use it for example, 3 months. Don't buy it so prematurely and try and do it every day. We can't do that. We have to do it in our dedicated period. I think that's another common thing that I see happen. Make sure you get your money's worth, because it's a lot of money. Make sure you use that all.
You use that all. Okay, that's amazing. So what are the key differences between step 1 and step 2 in terms of content and preparation strategy?
Okay, so step 2 is a lot harder. The reason I say it's a lot harder is because it's a lot more disorganized. For step 1, I think the fortunate thing is it's been divided into those subjects and to those certain topics. I can cover this subject, I can cover that subject. The problem with step 2 is everything overlaps. So although, for example, some people have come up with a way they do UWorld subject-wise, but that only helps to a certain degree, and it's all of medicine that you have to remember, all of surgery, all of peds. So it becomes a bit tricky like that. For that reason, I personally just found it a lot harder to study for step 2, even though I like clinical more. But I just found it a lot harder to study for it.
Okay, so you consider it like step 2 is harder than step 1 for you?
I consider it harder, and just because of my experience, that I felt like it was very chaotic. I did not understand. It took me a long time to get. Then for that, I had to 100% UWorld, because there was just a new topic in every question that I had to learn.
How long should students plan to study for each step of USMLE?
Again, so this would vary on you. You might take a certain amount of time, I might take a different amount of time. I told you guys I took about 2 years for step 2. Step 1, this is a bit famous about me that I studied for it in 2 months. Reality was I was studying a little bit before that. My dedicated time was 2 months, which again is not something that I recommend. Do not be doing that. I would say, honest, a dedicated time period, which you're just doing UWorld and you're near the exam, 3 to 6 months is a fair estimate. Dedicated time, I would say, if you want to like ace the exam. Before that, I would say if you've been studying for a good 3 to 6 months, that should be enough. So total, we probably look at a year, but this can vary very heavily. Some students might do it in 6 months, some idiots might do it in 2 months, but that depends entirely on you.
So in dedicated period, like 3 to 6 months, so how many hours we study for a day, like 10 hours, 8 hours?
I would say, Anas, so although I'm usually not a big fan of quantifying, I don't usually like this, but on average, I would say that you need to at least be at 8 or more hours, at least that much, because you need to at least be getting through a block or at least 2 blocks. Yeah.
So how should students balance studying for the USMLE with other commitments such as clinical work or taking classes in medical school?
It's very difficult. Again, for everyone, I wasn't able to do it. Everyone asks me, sir, late na shwe, taso graduation pass work? Because I couldn't do it. I was too tired after clinic. I was too tired after wards. I just couldn't do it after that. It's hard. You need an insane amount of discipline. You need an insane work ethic. Yeah, you need to be able to do it, and it's going to be very hard
to do it in your medical school.
Do it in medical school. You would definitely have to take advantage of some things. For example, doing Anki in your free time. You have 5 to 10 minutes. You can do Anki in that much time. During classes, try and correlate it with what comes up in step 1, what comes up in step 2, but it definitely is a difficult task.
Okay. What are some common mistakes to avoid during USMLE preparation?
So, again, trust yourself. You know how you study, stick to that. And again, don't go announcing to the world that you're doing USMLE. Like, I'll tell you that just from personal experience, it screws you over for no reason. Don't do that to yourself.
So, are there any test taking strategies or tips that can help improve performance on the USMLE exam?
Yeah, so
Like it's a bit long, 7 or 8 hours.
It's
you know.
so there's a few things you need to understand about the exam.
Mm.
It is a full day of dedication.
Mm.
It's going to be tiring. It's a 7-hour exam.
Exactly.
You need to build up stamina.
Mm.
That's why, again, I recommend UWorld, because you can build up the stamina while getting used to the interface. The second thing is it's time management. Each block is 60 minutes. Sometimes that can catch up to you. Alhamdulillah, I do think that I'm somebody who finishes my exams quickly. And I would struggle for time in these exams. I would be like, yeah, you need to stay conscious of the clock. For everyone, there's a very great video by Dirty Medicine. I believe it's called How to Get 260 Plus on Your Exam. It talks about certain biohacks. Basically, it talks about techniques.
I will mention the link in the description.
Yeah, I can give the link in the description. It's a brilliant video. I follow that as well. These are ways then to keep it showed how to keep your energy at a good level. So I definitely think for sure that is a video. If you're giving the exam soon, please watch that video. It's a very good video.
Okay. How helpful are flashcards for preparation?
I love Anki. I love flashcards. They help me in step 1, they help me in step 2. I'm doing them for step 3 right now. I love them. It definitely helps. And especially I think for students, again, the balance thing with having to do your wards and stuff, there is time where you're free for 20 minutes. That is not enough time to go to UWorld and do a block.
Exactly.
It's enough time to do Anki.
To Anki.
Yeah, so that's why I'm a very big fan of flashcards. And that repetition aspect, that really helps with memorizing.
So when to buy your word? At start of preparation or once you are done with your preparation? As you mentioned before, but still I want to...
Yeah. So in the US, how it works, their students, they buy it for a year and they do some questions every day. For us, it costs too much. We can't do that. For that reason, we will do it at the end in a dedicated time period. And that is the best. I think that is when you should do it. When you've gone through the syllabus for step 1. Once you've gone through the syllabus, then you can start going through UWorld. It makes a lot of sense that way. Thankfully, we have resources that you can go through the syllabus. For step 2, you don't have a choice. You have to buy UWorld. That is the only thing you're going to study from.
Oh.
So there's where another difference will come in for step 1 and step 2.
Now come to a very amazing question. I really like it. Describe your father and mother in one word.
Okay, so just one word.
Yes, sir.
Just one word. If I had to pick one word for my father, it'd be hardworking.
Okay.
To this day, ever since I was a little kid, and I think even the work ethic that I have to this day, that it's probably the one thing I'm quite proud of myself, that I have a very good work ethic. It's all because of my father. Even everyone is very well aware of him, Dr. Niazali.
Yes.
To this day, in this age, he prioritizes his work. He never complains about the amount of work that he does. He will work from 7 a.m. to however long is needed, but he makes sure that the job is done. And then I think there's Allah has made us in pairs.
Yes.
My mother is the perfect balance. She's extremely caring, and that's the word I choose for her. The reason is because my father focuses on his work so much, it's natural. You're prone to burnout. You're prone to getting tired.
Yes.
My mother is the one who makes sure that doesn't happen. She's the one looking out for her. And I think that's something that makes it a wonderful balance. And again, my mother looks out for us as well because we also have that work ethic. So she's the one making sure things are under control. Things don't get out of control. So I think those are the two words I picked.
Okay, so your father is hard worker?
Yep.
And your mother is extremely caring?
Caring, that's the words.
What are some ways academic institution can support the mental health being of students as well as teachers?
I'm very glad you asked this, Anas. This is a very good question. And I think it's a very important topic nowadays.
Exactly.
It's a very difficult answer. I think if there was one answer to this, I think all places would have figured it out by now.
Exactly.
There's a few steps I think that all institutions need to take. Number 1 is awareness. And I think unfortunately we do head in a bit of the wrong direction when it comes to this, in that we make mandatory lectures, we make mandatory workshops. For trainees, we make mandatory workshops, mandatory modules, just you have to sit to a computer and learn all these things. It's just general awareness. And I think honestly, for me at least, the best way to become aware of how bad mental illness can be was exposure. One of my friends suffered from a lot of mental health illnesses. I suffered from a lot of mental health problems. That was how I became more aware of how bad it could be. And because of whenever I saw patients even as well, it made me understand a lot more on how difficult it can all be. Number 1, I would put that they need to incorporate awareness somehow, but not in the way that
Yes.
I think that's the wrong approach, because you're sitting there, you don't want to be learning.
Exactly.
You need to want to learn about this. The second, one of the more important things, help needs to be available when needed. I think the unfortunate thing with mental health is when things get bad,
Mm-hmm.
it's usually already too late.
Exactly.
You're at a very extreme point. There are certain interventions that you need. There are certain safety nets that you need at that point. I think, for example, one good line is that, okay, you know that there's a dedicated person for mental health. For example, there's a psychologist, there's a psychiatrist for the students, for the faculties. You know you have the security that I can talk to this person.
Exactly.
You need that person, especially because when things get bad, you need that person on that spot, or
On that
else
spot.
if they don't intervene in time, if they're not available in time, we don't know what could happen.
Exactly.
And I think the third, and probably the most important thing, the environment needs to be friendly.
Yes.
I'll tell you this, that in a toxic environment, mental health problems are going to be rampant.
Exactly.
Everyone is going to be suffering from them.
Exactly.
But unless if you enjoy coming to college every day because of your friends, if you enjoy the same way I enjoy coming to work every day because of my colleagues, because it's a wonderful work environment, you will naturally see improvement in mental health. And I have felt this personally. I was in a very, very awful place. But when I joined here, I have colleagues who are, alhamdulillah, very, very fun to interact with. And it's not that I was sharing all my problems with them. It's just day-to-day interactions. It helped a lot. And I started getting more grounded. Things started to look a lot better. So I would say that these were the three things. Number one, awareness.
Awareness.
Number two, help needs to be available.
needs to be available.
Especially when we're talking about health, hospitals, you need at least one psychiatrist, one psychologist available at all times. And third, just in general, that the environment can't be toxic. Don't let it be toxic. I don't have the exact answer on how to do that. It's dependent on the people, it's dependent on the upper management as well, but it's something that does need to be figured out. It's very important.
What are the best advice that you can give to the audience who are watching this podcast?
Ooh, to the audience watching this podcast. I think if there's one thing that I've learned, is, again, I mentioned it from my father as well, but the phrase that I will say to all of you, work hard. It doesn't matter who you are, it doesn't matter what position you are at. Work hard. And again, I want to clarify this, although I'm right now speaking from the position of a teacher. I don't mean to shava kitab takena, study all day. That's not what I mean. Whatever it is you do, whatever it is, do it to the best of your abilities. There is absolutely nothing wrong with failing. We all fail. We all feel ashamed when we fail.
Exactly.
I personally try and hide my failures, but I've learned over time that there's nothing wrong with the failure. The thing that's bad, not trying.
What advice would you give to me to improve myself and to improve our community around me or around us?
So for the viewers who may not know, I met Anas by Kismat, you can say.
Exactly.
You had approached me, I think you had mentioned that you were doing your electives in Aga Khan. And
Exactly.
because everyone knew I'm the person from Aga Khan. So I remember I met him through that. And I will say he's a remarkable individual. He wasn't the standard just come up to me and say, Sir, padhte kaise hain, ye kaise karte hain? No. He has a wonderful personality.
Thank you so much.
I think the biggest piece of advice I'd say, hold on to your personality. Success, everything will come to you, inshallah. I have no doubt about it. And how it will come, that is again, not for me to decide. Inshallah, it will come to you.
Inshallah.
But hold on to your personality. You have the kind who, you light up a room, you manage to convince your teachers to sit down and do a podcast with you.
Exactly.
I don't think I've ever met a student like that in my entire life.
Yes.
So hold on to your personality,
Thank
keep smiling, you have a wonderful smile, keep it up.
Thank you, sir. Thank you so much, sir.
No problem at all.
Hafiz.